Besides structure, the other big thing that we address from the start is mobility. And if you don't have the right amount of motion in your spine, if say for instance 2 or 3 or 4 segments of the spine are locked up, maybe due to just years of bad posture, years of sitting, or a lot of times past auto accidents or sports injuries, if you're not moving right, you know what, these joints aren't getting the right amount of water, nutrients, and then not to get too technical, but you've got to have a normal amount of motion so that it feeds into your spinal cord, into your brain, into your whole nervous system, which kind of drives every function of your body. So we'll save that subject for a different time, but needless to say, motion is important. And if someone's neck motion, for instance, like in this first set of before and after pics, this gentleman is bending his head backwards. You can see he's really not able to go back very, very far. And in the middle and upper part of his neck, there's just absolutely no backward bending. And so you can see after treatment with us, he's able to go back much, much further. And so from my career in physical therapy, before I even got into chiropractic, I found there is such a close correlation between full normal range of motion with no pain versus someone who has pain, who has limited motion. And when we can improve motion along with improved structure, we're not only helping the person feel a lot better, but we are really, really impacting their overall health for the long term as well. The second set of pictures is a low back. And of course, with this picture, now again, we're looking at an X-ray. So think of it as like we're looking at a picture. So this person, he's actually bending off to the left. And you can see in the first picture where he's going to the left, he's very, very limited. And I wanted to show you this too. This is more of a subtle thing to look for. The white things in the middle of the spine, these are these bumps in your spine. And so when you bend to the side, they're supposed to rotate as well. They're supposed to rotate to the side you're bending towards. So if I'm bending this way, it should also be rotating this way, if that makes sense. And so you can see when he bends to the side, these bumps remain in the center. Now you see in the after picture, you see him bending, not only bending a lot further, but these bumps, they're moving to that same side, aren't they? So that means they're naturally rotating in the direction they're supposed to. So that's kind of more of a subtle finding, but that's something that we look for in all of our patients. Because again, you know, my job, your first visit, is to be a detective, to find out exactly why you have the problem that you have. So we're gonna look at structure. We're gonna look at function, our motion, in addition to everything else. But we're able to utilize the X-ray and do a very, very detailed exam to find out the cause of the problem, so then we can actually truly address it. So I hope you enjoyed this video. Have a wonderful day, everybody.